The squat is a common exercise performed at gyms and in rehabilitation, quite common in home exercise programs. It's something we perform every day when we get up and down from a chair, sit down on the toilet, and more or less everybody needs to be able to perform this to live independently. There are many theories about how to perform a squat and how much range of motion you need to successfully perform it. The relationship between the ankles, the knees, the hips, whether the trunk should be flat or curved. This very much depends on sport specificity and different schools of thought about an optimal squat. This person is performing a double leg squat with the feet facing forwards. And it's very clear that there's some asymmetry here in the person's movement. Although because the squat's such a complicated movement, it's difficult to put your finger on what's going on without measuring it. Using digital analysis, you can see what's happening in the foot, the ankle, the hip, the shoulders, and the head all together. Analog or visual analysis really only permits you to look at a couple of body parts at a time. In this case, the person's right leg is traveling further than the left leg, and it's going out at 12 degrees. The hips are moving towards the right leg, and the shoulders are also moving towards the right leg. It appears as though the left is moving more than the right, and that can be due to tilt and also because of rotation. If we look at this squat from the side, it looks like a nice performance. Trunk leaning forwards, hips sitting down, knees going forwards. Overall, a nicely performed squat from the side, but clearly not from the front and clearly not from helicopter view. Let's look at this squat in a little bit more detail. Firstly, we can see where the center of mass or the body's weight is distributed. It starts in the middle and gravitates towards the right leg. The feet are in fact symmetrical. So you see that both toes are against this line and they're both pointing forwards, but the trunk is rotating at the hips and at the shoulders, and the whole body is moving towards the right leg. If we take a helicopter view, you can see the amount of rotation that's occurring. Quite neutral at the top, but right shoulder forward at the bottom. This right knee is clearly forwards compared to the left knee. If we look from the floor perspective, which is very important if we're looking at sports performance because this is where the forces come from. You can see this shadow of the center of mass is moving towards the right foot. The knee is coming a lot more forwards than the other side. There's some rotation and movement of the trunk towards the right and also the hips. Not to mention the rotation in the shoulders. If we look at the biomechanics report for this individual, once again we can see the trajectories of the knees, the pelvis and the shoulders all moving towards the right. The dark blue line represents the trunk, which first moves slightly to the left and then does a correction and moves to the right. And that would be this little kink in the line here. So slightly to the left and then to the right. Quite gradually to the right until it reaches a bottom position and then more or less comes straight back and overshoots the original position here. So the start position and the end position, as far as the pelvis is concerned, are not the same. If we look at the shoulders first, we can see that the right shoulder, which is this green line, is moving laterally. And the left shoulder, which is the yellow line, is moving medially. First down and then quite dramatically inwards. First down and then quite dramatically inwards. Now of importance here is the knees, and particularly the right knee. So here we have the right knee in blue, which is going outwards, down, out, down, and then coming back again to the start position, and again overshooting the original start position. The left knee is also moving laterally in the beginning, and then medially, and then coming back to center again. So a very soft C curve here, and a very, very soft, almost straight line on the right side. That right knee happens to land 2.5 centimeters lateral to the original knee position. But it doesn't move as much as the shoulders do. That left shoulder is moving 4 centimeters, the right one only 1. So quite a lot of movement in this left shoulder, thanks to the rotation in the trunk, and quite a lot of movement of the right knee. Here we have a double leg squat with a rather exaggerated L shape. The knees are going down and out, and then very dramatically coming in at the bottom. Normally explained by end of range of motion in the ankle dorsiflexion, and as the feet fall inwards, then the knee tends to follow. In this case it's exaggerated because this person prefers to go outwards, and because they're at the bottom of their movement quite lateral, the distance they cover to land medially is fairly dramatic. This person would experience a foot that quite possibly is bearing weight on the outside of the foot, and at the bottom of the dorsiflexion range, or the bottom of the squat, the foot basically just flops in, causing problems in the foot and clearly problems in the knee, and quite possibly some problems around the hip joint. If we look at the squat from the side, the technique looks very nice. Reasonable angles at the ankle, the knee and the hip. But quite clearly this person needs to work on their ankle range of motion, which could come from tight calf muscles or some issues in the joint. Interestingly, this is not a symmetrical squat. Although the pelvis moves vertically down, both shoulders have a tendency to move towards the right hand side, and this probably explains why this angle is so dramatic. So as this moves more medially, the shoulders seem to be accompanying it. In fact, when you look at the downward action of the downward path, this one is actually a bit larger than this one, which tends to be more vertical. So the shoulders moving towards the right, and both knees tending to move to the right, even though this one is going outwards. Looking at the squat in the Moovement Lab, it's very clear to see this center of mass moving to the right hand side during the squat, hence that tendency for the whole body to be moving a little bit to the right. Even though this knee is going out, the whole body is moving a little bit to the right, which is reflected by the shadow here, the shadow of this center of mass. And it's very easy to see the knees coming in. There's a large degree of internal rotation there. If we look from helicopter view, that internal rotation will be seen as quite dramatic there. If we look from the floor up, we can very clearly see that center of mass moving towards the right side, almost in a bit of a C shape, and then the knees at the bottom falling inwards. it appears as though this right knee falls inwards just a little bit more than the left one. The biomechanics report for this individual is very obvious. The movement of the trunk coming off midline, going back to midline, and coming off midline again. So movement to the right is denoted as negative on this axis. It's not such a large movement, but in any case it exists. Then we have the movement of the trunk, so both shoulders having a tendency to move towards the right hand side. So this right shoulder moving laterally and this left shoulder moving medially, and they're very similar shapes. These events seem to happen with the same sort of patterns. And looking at the knees now, becomes very, very clear that the right knee goes laterally quite dramatically. The left knee also goes outwards, so there's a tendency here for this person to move their knees outwards first before they engage in the squat. And then this dramatic turn here, medially for the left knee and medially for the right knee. So keep in mind the right knee has moved out quite a lot laterally and then comes back to middle and goes past middle and becomes very medial indeed. Neither knee finish in exactly the same position that they started, nor does the pelvis. The left knee moves almost 4 centimeters medially, and the right knee moves 2.5 centimeters medially. Here we have a double leg squat where the person is sitting down and then moving the body to the left hand side. There's a tendency for the right leg to go lateral from the very beginning, suggesting that the person is probably trying to avoid the right leg by moving the upper body to the left hand side and loading the left leg, which is doing a very nice job of acting in a vertical direction. This lateral movement of the knee could very easily be because of some changes in the knee or changes in the ankle or even changes in the hip. Clinical investigation would allow a therapist or a trainer to isolate a hip, knee or ankle problem which is causing this very subtle shift of body weight to the left hand side. Looking from the side, this person is very upright for most of the squat and has a tendency to even lean backwards in the beginning, which loads the thigh muscles and tends to disengage the glutes and the hamstrings. Not uncommon with somebody who's got a back problem, which is affecting one side of the body, in this case probably the right hand side of the body. But once again, this should be evaluated by a physical therapist if indeed this person has an injury or complains of pain. Let's look at this performance in the Moovement Lab and see in a bit more detail what's happening. The center of mass tends to be floating around the middle position. If anything, it starts to the right and then moves to the left. The body has a tendency to shift to the left-hand side, but everything looks fairly symmetrical in the trunk, and it's more at the bottom of the movement that the person tends to gravitate towards that side. So it would suggest that around this angle, the body wants to move away from something on the right-hand side and favors the left-hand side. If we look from the top, we'll be able to see how that center of mass moves towards the left during the movement. And if we look from the bottom, we can see the same thing. Towards the end of the movement, around here, the center of mass moves because the hips tend to move and go out to the side. We can confirm the assumptions from our visual observation by looking at the data in the biomechanics report. We've already discussed these values here with the trunk migrating towards the left knee going straight down, but the right knee tending to go outwards and downwards. Here we can see the trunk in dark blue, and this very clearly demonstrates the movement towards the left, this section here. The left knee has a little bit of a shaky pattern to it, but it's quite close to the axis, and to be fair, the scale is only 3.5 centimeters, so this wasn't much movement at all. But looking at the right, it's very clear the right knee goes laterally, and then it flattens out, and then it comes back again towards the start position, but does not achieve the start position. So if we take a look at the right knee in particular, it moves 2.3 centimeters laterally, and the left knee more or less is vertical. This person is performing a double leg squat where the knees quite clearly fall inwards into adduction, internal rotation. There doesn't appear to be too much movement of the feet, just looking at them from a distance. However, the knees clearly go down and inwards, more or less in a straight line. There's a little bit more of a J form on this left-hand side. It starts off going in gradually and then has a little bit of a abrupt ending, if you like. This type of action is normally because of some weakness in the external rotators or overactive internal rotators of the hip, especially in the absence of pronation of the feet. This can be seen with a pronation of the feet, but in this case we don't really see that here. It's bilateral, meaning it's on both sides, with a bit more at the end of range on the left, possibly because of the ankle joint, or possibly because of a decreased strength on the left compared to the right, or at least motor control. The upper body looks great. It has a tendency to go straight down. If anything, the pelvis moves slightly to the left, but it's not really significant. If we look at the squat from the side, it's functional. It looks reasonable. The person's slightly leaning forwards, so they are indeed engaging their posterior muscles. Mind you, there is not a great deal of dorsiflexion here in the ankles. Let's look at this movement in a little bit more detail. Now we can really see what's happening with that left knee. If we slow things down, both knees go down, and then around about here, that left knee has a tendency to go in a little bit more. So if we needed to prescribe some exercises specifically for the left knee, if that was symptomatic, you'd be asking questions about these joint angles and consider rehab exercises that were specific to these joint angles. On the way up, the person seems to come up quite comfortably. Let's have a look at helicopter view and see what happens there. Both knees internally rotating, that's very clear. The left one being more than the right. From the floor perspective, once again, you can see both knees falling inwards, adduction, internal rotation. Center of mass stays fairly central, the left knee at the end going into a little bit more internal rotation. The biomechanics report gives us a little bit more detail about the exact measures. The trunk behaving quite nicely, vertical movement there. Both knees going in with a little bit of a J curve on the left hand side. So if we focus on the left knee first, we can see that it's going down and then quite dramatically coming down with a bit of a tighter angle there than this softer angle, which is on the right hand side. Both knees coming back parallel quite nicely, not quite to the start position. So this left knee here is going in 3 centimeters, and the right knee is also going in 3 centimeters. They just happen to do it in a slightly different pattern. Here we have somebody performing a double leg squat with a very clear L shape on the left leg and a slight tendency to move outwards with the right leg. The upper body is moving quite nicely, vertically. This tends to happen when the range of motion in the ankle has run out, and the body's way of getting a little bit more flexion is to rotate the foot inwards, eversion or pronation as you like, in a combination with internal rotation, adduction. It's not unusual after an injury to the left leg that the right leg has a tendency to move outwards, often as a compensation strategy. There is a tiny bit of movement of the trunk here towards the opposite leg, but it's not so much at all. An interesting observation here is when the person does a squat on one leg, it's a similar phenomena. An L shape on the left hand side, quite nice performance on the way down, but a very abrupt inward movement thanks to some movement compensation or dysfunction in the ankle. If we look at the squat on the right leg, we can see the trajectory of the knee is vertical with a little bit of a hip hitch and some compensation for balance in the shoulders, but definitely not this lateral movement that we observed on 2 legs. In this case, I think it's fair to presume that some problem on the left-hand side has been accommodated or compensated for by the right knee taking the body weight or taking responsibility for the whole body by moving slightly outwards in response to this dysfunction here. If we look in more detail at the squat, you can see the center of mass is slightly to the right hand side, probably offloading this left leg. Otherwise the upper body moves reasonably well. If we look from above, we can see how obvious this internal rotation adduction is. And from the feet down and then very dramatically inwards, accompanied by some eversion or pronation of the left ankle. Looking at the left leg, single leg stance, we can see the same phenomena here, sitting down, quite a dramatic L-shaped movement inwards, adduction, internal rotation with some rotation of the foot into pronation. That will become much more obvious when we look at helicopter view. And a view from the floor. Very clearly this knee is moving inside of the foot. And although there may be some compensation in the limb for something, a restriction in the ankle, it's definitely compromising the knee.